Thank you for the opportunity to join you today. It's a pleasure to bring you greetings from the National Institutes of Health and the NIH Office of AIDS Research. In 2019, there were almost 38,000 new HIV diagnoses in the United States, with 26%, almost 10,000, among Black, gay, and bisexual men. Clearly, this disparity must be addressed. Today, I will provide an overview of the NIH Office of AIDS Research, update you about some of our key activities relevant to HIV prevention and treatment among Black MSM, describe NIH's role in ending the HIV epidemic in the United States initiative, and address the impact of COVID-19 on the HIV research enterprise. The NIH Vision is to advance HIV research to end the HIV pandemic and improve health outcomes for people with HIV. More specifically, the mission of the Office of AIDS Research is to ensure that NIH HIV research funding, about $3.1 billion annually, is directed strategically at the highest priority research areas and facilitates maximum return on that investment. Congress established the NIH OER in 1988 to plan, coordinate, and track the scientific, budgetary, legislative, and policy components of all HIV research across the NIH, and to report about the NIH HIV research enterprise to the NIH Director, the HHS Secretary, the President, and the Congress. Two important features about OER. One, the OER is within the office of the NIH Director, not within one of the institutes or centers. And the OER has the authority to distribute funds for HIV research across the NIH institutes, centers, and offices. Many of the 27 NIH institutes and centers have HIV research agendas, as illustrated, and include, among others, the National Institute of Allergy and Infectious Disease, as well as National Institute of Mental Health, Minority Health and Health Disparities, Nursing Research, and the Office of Sexual Gender Minority Research. Partnerships are essential for OER to achieve the executive and legislative mandates. OER works collaboratively with multiple government agencies and with academic institutions, professional and civil society organizations, and their representatives, including advocates, community members, researchers, and the private sector. This network of partners ensures that the NIH's HIV research portfolio is multidisciplinary, includes input from many perspectives, and leads to a robust program that has been incredibly impactful over more than 30 years. These partnerships are central to how the OER develops the scientific priorities for the NIH HIV research agenda. The priorities include reduce HIV incidence, essentially prevention research, including vaccines, develop next generation HIV therapies as treatment for HIV and HIV-associated comorbidities, co-infections, and complications, and research toward an HIV cure. The priorities are linked by cross-cutting research in basic science, behavioral and social sciences, health disparities, implementation science, training, and capacity building. The scope of HIV projects extends from basic, translational, and clinical research through implementation science and its effect on public health and policy. The scope of research continues to evolve based on recent scientific advances, ongoing global and domestic needs, and emerging research opportunities. The development of the NIH HIV research agenda considers multiple factors, including the National HIV/AIDS Strategy. Under the expert leadership of Mr. Harold Phillips, Director of the White House Office of National AIDS Policy, or ONAP, released the revised National HIV/AIDS Strategy on December 1st, 2021 World AIDS Day. One of the core themes of the revised national strategy is the need to reduce health disparities to improve health outcomes for people with HIV. This is particularly relevant to Black, gay, and other MSM who are so disproportionately affected by HIV in the United States. The revised NHOUS includes increased attention to and integration of research across the strategy's goals and synergizes well with the NIH HIV Strategic Plan and the National EHE Initiative to assure comprehensive translation of HIV scientific discovery to implementation for public health and policy. NIH-supported HIV research has led to recent significant advances. For example, just 3 weeks ago, the FDA approved the first injectable long-acting treatment for HIV prevention among at-risk adults and adolescents. Long-acting, or LA-cabotegravir, is a much-needed addition to the HIV prevention toolbox and resulted from research supported by the NIH Office of AIDS Research in partnership with pharmaceutical companies, scientists at universities, the NIH, and thousands of community partners and participants in the HPTN 083 and 084 studies in the United States and globally. Another example is the current population-based research involved with the HPTN 096 protocol, piloting integrated approaches to reduce HIV incidence among Black, African American MSM in the US South by increasing HIV testing, PrEP uptake, and viral suppression rates. The integration of these approaches means addressing the feasibility of combining biomedical technologies for HIV prevention and treatment with mitigating some of the structural inequities and discrimination that limit Black MSM's access and uptake. More broadly, NIH is expanding research investigating the impact of behavioral and social factors, including intersectional stigma, on HIV among Black and other MSM of color. Examples of current research administered by NIH's National Institute on Mental Health, Institute on Drug Abuse, Institute on Nursing Research, and the Institute of Allergy and Infectious Diseases is focused on community-level interventions to reduce intersectional stigma and increase HIV testing and prevention. New measures of multi-level intersectional stigma to improve the HIV prevention continuum. Enhancing integration of HIV and mental health services for young, Black, gay, bisexual, and other MSM. And these are just a few of the activities. The NIH OAR invests in infrastructure to enhance diversity and strengthen research capacity. For example, OAR has a unique authority to deploy up to $8 million annually for construction and renovation projects. Recently, OAR investments for construction and renovations in rural areas and at minority-serving institutions involved collaborations with the National Institute on Minority Health and Health Disparities for their research centers for minority institutions, or RCMIs. In addition, in fiscal year 2021, OAR provided a specific allocation of $500,000 to the Meharry Medical College and its Center for AIDS Health Disparities Research. OAR facilitated a new funding collaboration between the National Institute of Minority Health and Health Disparities and the HHS Office of the Assistant Secretary for Health. The Assistant Secretary, Admiral Rachel Levine, approved almost $2.3 million from the Minority HIV/AIDS Fund for administrative supplements to support collaborative HIV research at the RCMIs. NIH OAR continues to convene listening sessions across the country to expand engagement with our various partner communities. Since 2018, 14 domestic listening sessions and community engagements have been held in 15 locations, involving over 950 people. Most recently, in early December, an NMAC NIH OER listening session hosting about 60 participants was held virtually in conjunction with the US Conference on HIV/AIDS. These rich sessions provide valuable feedback that translates into OER priority setting and programmatic activities. Among the themes we hear consistently is the need for enhanced academic community partnerships, in which community-based organizations are equitably engaged, compensated, and supported for collaborative research. Another theme is the importance of ensuring a diverse workforce and the next generation of HIV researchers. This is critical because novel ideas and innovative discoveries often come from investigators who have varied backgrounds in thinking, are new to the field, or are early in their research careers. In response to what we heard at listening sessions, in 2021, OER convened a series of engagements with early career HIV investigators and an expert panel of senior researchers, shown in the photo here. Key issues raised by participants focused on the challenges for expansion and support of new HIV investigators, including expanded diversity, supported mentoring, innovative funding mechanisms, appropriate peer review, enhanced networking opportunities, and centralized information. This feedback prompted OER to increase support for early career HIV investigators, design and develop web-based resources and guidance for HIV early stage investigators, and organize a series of symposia starting in spring 2022 to catalyze networking among HIV-focused early career and senior investigators and NIH HIV program experts. Finally, I'd like to say a bit about COVID-19. The OER continues to closely monitor COVID developments in addition to maintaining focus on HIV research. Although still early to assess quantitatively the full impact of COVID-19 on HIV research, based on listening sessions conducted by the NIH OER across the United States, the COVID pandemic has placed a tremendous strain on sustaining research in general. Research laboratories were closed for months. Clinical trials were placed on hold or closed early. Supply chains and core facilities were disrupted. With all the challenges for HIV research in these times, it's also important to note how NIH investment in HIV research over the decades enabled a rapid scientific response to COVID-19. Many of the major COVID-19 initiatives were built on existing HIV frameworks, infrastructure, and discoveries, providing our country with a head start for COVID-related research for vaccines and for treatments. And as the COVID efforts benefited from HIV, many lessons learned from the COVID pandemic response will benefit the HIV field and the larger biomedical research arena going forward. For example, innovative funding mechanisms and rapid deployment of discovery pipelines that have the potential to accelerate HIV research, discovery, and translation. The deployment and development of multiple COVID-19 vaccines in less than a year is an incredible research accomplishment. As for the timeline to develop and deploy one or more effective vaccines for HIV, we need to consider that the biology of HIV and its persistence within the human host is far more complex than that of SARS-CoV-2. Nonetheless, NIH is accelerating the testing of promising HIV vaccine approaches based on RNA technologies and structure-based design HIV antigens that could provide the foundations for innovative vaccines to induce protective immunity against HIV. In conclusion, a whole of science and a whole of society approach is essential to accelerate HIV research that leads to ending the HIV pandemic. As we start the new year, the NIH Office of AIDS Research renews its commitment to continue working with the Black MSM community to end the HIV epidemic in the United States and globally. And on behalf of my colleagues at the NIH and the OAR, we wish you and those you love a safe, healthy, and happy New Year. Thank you again for the opportunity to present at this important meeting.